Have you ever wondered what signs our body gives us when it's nearing the end of life? It's not something we often talk about, but understanding these signs can make all the difference. In today's video, we're diving into 12 warning signs that indicate the end of life, and more importantly, what you can do if you recognize these signs. This isn't just about awareness. It's about empowering you with knowledge to handle these delicate situations with care and understanding. Stay with us until the end, because the crucial steps and advice shared could be life-changing for you or someone you love. This introduction sets the tone for an informative, sensitive, and empowering video, encouraging viewers to stay engaged for valuable insights. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Number 1. Decreased appetite and thirst. As the body prepares for the final stages of life, it instinctively begins to reduce its need for food and water, focusing its remaining energy on sustaining only the most essential vital functions. This natural process may present as a general disinterest in eating and drinking or some cases, difficulty swallowing. For many individuals in this phase, the body's signals reflect the shift away from sustaining itself in the way it once did, signaling a deepening transition. Take, for example, Maria, an 85-year-old woman living with advanced heart failure. Over time, she began to notice a distinct lack of appetite. Foods that she once savored, including light soups that she adored, no longer appealed to her. At first, her family attributed this to the toll of her ongoing illness, but the situation worsened when they realized she had stopped drinking as much water as she used to. She seemed weaker, and her once vibrant energy was noticeably diminished. This sudden decline in her appetite and thirst left her family feeling anxious and unsure of what was happening. Concerned, they sought advice from her doctor. After a thorough evaluation, they learned that Maria's lack of appetite wasn't simply a symptom of her heart failure advancing. It was also contributing to mild dehydration. This was not uncommon in the end-of-life process, where the body systems gradually slow down and food and water intake naturally diminishes. To address her symptoms and improve her comfort, Maria's doctor recommended a tailored approach. Instead of forcing large amounts of fluids, which would be difficult for her to manage, her family was encouraged to offer small, manageable amounts of liquids such as warm infusions and oral rehydration solutions. Additionally, they provided easy-to-swallow foods, like pureed dishes and soft jellies, that could help ensure she received some nutrients and hydration without causing distress or discomfort. Although her appetite never fully returned, these adjustments help her feel more at ease, providing her with the hydration she needed while respecting her body's natural process. It's essential to emphasize the importance of consulting a healthcare professional in such situations. A doctor can help discern whether the decline in appetite and thirst is an irreversible part of the natural dying process or if it can be alleviated to improve comfort. By working closely with medical professionals, families can ensure that their loved ones are receiving the best care possible during this delicate time, prioritizing both dignity and comfort as life naturally transitions toward its final stages. Number 2. Reduced energy and weakness. A reduction in energy and an overwhelming sense of weakness are often recognized as significant indicators that death may be approaching. Think of the human body as a finely tuned machine, one that has operated at full capacity throughout life, but now, as it nears the end, begins to conserve what little energy remains. This process can manifest as a persistent fatigue that makes even the simplest of tasks feel like monumental challenges. You may find it increasingly difficult to rise from bed, take a short walk, or engage in any physical activity that once felt effortless. Every movement might feel laborious, as if the body is simply too tired to continue. This constant state of weakness doesn't just affect the body. It profoundly impacts the mind and emotions as well. The relentless exhaustion can bring about feelings of discouragement, hopelessness, and isolation, making it harder to find the motivation or strength to engage with others or seek any form of comfort. The act of simply existing becomes draining, and the desire to fight against the exhaustion diminishes, leaving a sense of surrender to the overwhelming weariness. However, it's important to remember that there is still hope. In many cases, this decline in energy can be addressed and even reversed with the right care and attention. If the root cause of the weakness is something treatable, such as anemia, dehydration, or a deficiency in essential nutrients, medical intervention can make a significant difference. With appropriate treatment, energy levels can be restored to a manageable level, allowing the individual to regain a sense of vitality and hope. This might include the administration of vitamin and mineral supplements, ensuring proper hydration, adjusting medications that could be contributing to the fatigue, or introducing specific therapies to tackle the underlying condition. With the proper steps, it's possible to revitalize the body, boosting energy and providing relief from the pervasive exhaustion. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 3. Drop in body temperature. A drop in body temperature is a signal that the body is reducing blood circulation to conserve energy. When this happens, you may notice that you begin to feel unusually cold, and your skin, particularly on your hands and feet, may appear pale or even take on a bluish hue. This occurs because the body is prioritizing vital functions such as protecting the heart and brain. In colder conditions or during illness, the body redirects blood flow away from extremities to maintain warmth in the core, which can leave you feeling uncomfortable or chilled. This decrease in temperature is a natural physiological response that happens when the body detects the need to conserve resources, such as in the case of infections, metabolic issues, or even prolonged exposure to cold environments. Although it can be unsettling, it is the body's way of ensuring that critical organs receive the blood flow they need to function properly. Fortunately, in many cases, this drop in temperature can be reversed if the underlying cause is treatable. If the temperature drop is due to an infection, for example, addressing the infection with the appropriate treatment can help bring the body back to its normal temperature. Similarly, if metabolic issues are the cause, proper medical intervention may help regulate the body's temperature again. For those experiencing a drop in body temperature, several practical steps can help restore warmth. Wrapping up in extra blankets, taking a warm bath, and drinking hot liquids like tea or soup are all simple yet effective ways to raise the body's temperature and provide comfort. These actions help to warm the body from the outside, encouraging the return of healthy circulation to the extremities and promoting overall well-being. Number 4. Changes in urine and kidney functions. As the body approaches the final stages of life, significant changes begin to occur in many of its systems, including the kidneys. These organs, essential for filtering waste and toxins from the blood, start to function less efficiently. This decline in kidney function can be observed in several ways, each of which can be a sign that the body is adjusting to its natural process of shutting down. 1. Decreased urine output. One of the first noticeable signs is a reduction in the amount of urine produced. As kidney function declines, the kidneys become less effective at filtering the blood, leading to less urine production overall. In some cases, urination may occur less frequently, as the body tries to conserve what little fluid it has left. 2. Darker urine. As the kidneys struggle to filter waste, urine may become more concentrated, often taking on a dark yellow or brown color. This can be an indication of dehydration or more severe kidney issues, such as kidney failure. The darker urine may also signal that the kidneys are unable to adequately flush out toxins and waste products from the body. 3. Foamy urine. The appearance of foam in the urine is another potential sign of kidney dysfunction. When the kidneys are damaged, proteins, particularly albumin, can leak into the urine. These proteins cause the urine to foam, which can be a subtle indicator of kidney damage. If this symptom is noticed, it may require further investigation to determine the extent of kidney impairment. 4. Fluid retention. As kidney function diminishes, the body becomes less efficient at removing excess fluid. This can lead to fluid buildup, which often manifests as swelling in various parts of the body, particularly the feet, legs, and abdomen. The retention of fluid is the body's way of attempting to preserve essential fluids while adjusting to the limitations of the kidneys. 5. Reduced nighttime urine production. Many people notice that they produce less urine during the night, and this is especially common when kidney function starts to decline. The kidneys may fail to filter fluids effectively, leading to a decreased need for urination at night. This reduced nighttime urine production is often a subtle yet noticeable change in the body's pattern of fluid regulation. 6. Pain in the kidneys. Discomfort or pain in the lower back, near the kidney area, can occur as a result of kidney dysfunction. This pain may vary in intensity and could be a sign of inflammation or damage to the kidneys themselves. In some cases, the pain may be accompanied by a feeling of pressure or tenderness in the area. In addition to these changes, The body's attempt to conserve energy and maintain vital functions may be reflected in fluid retention and a further reduction in urine production. These adaptations are a natural part of the process as the body begins to prepare for the end. While some of these changes in kidney function can be temporary and even reversible with appropriate medical intervention, it's crucial to address them as soon as possible. Identifying the underlying cause of the kidney dysfunction and seeking immediate medical attention is vital for maintaining comfort and well-being during this difficult time. If you or someone close to you shows any signs of kidney problems, it's important to consult with a healthcare professional without delay. Number 5. Changes in mood or behavior. When a person begins to show noticeable, sudden changes in their mood or behavior, such as becoming unusually irritable, anxious, or even depressed, it could signal something more significant occurring beneath the surface. These shifts are not always simply a result of everyday stress, but can sometimes point to underlying physical or emotional factors that need attention. For instance, physical causes such as hormonal imbalances, which can affect emotional regulation, or chronic pain, which can contribute to feelings of frustration or despair, may play a role. Additionally, emotional shifts are a natural part of the dying process, and the emotional and psychological changes that occur as someone approaches the end of life can sometimes manifest in ways that are unexpected or difficult to understand. In some cases, individuals may even express strange or unsettling thoughts, such as mentioning that they are preparing for a journey, or in rare instances, begin packing a suitcase, as if they are ready to embark on a trip. While this behavior may seem strange, it could be a reflection of the individual's subconscious awareness of their impending transition. Such comments or actions are often unsettling for loved ones, but they may provide valuable insight into what the person is experiencing emotionally or psychologically during this time. If you notice that a family member or friend is exhibiting these kinds of behaviors, it is important not to dismiss them or chalk them up to mere stress. Instead, consider seeking professional help to address the situation. Many of these mood changes are reversible or manageable with the right interventions. Treatment options could include antidepressant medications to help regulate mood, adjustments in painkiller dosages to ensure the person is not suffering unnecessarily, psychological counseling or therapy to provide emotional support, and even environmental changes to create a more calming and peaceful atmosphere. By being attentive to these changes and taking steps to provide the necessary care, you can help improve the quality of life for someone going through a difficult period, whether it's due to physical health concerns or the emotional toll of an impending loss. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 6. Decreased sensory functions. This signal can manifest in various ways, such as partial or complete loss of hearing, vision, taste, and touch. These sensory changes often occur when the body is prioritizing its energy for vital functions, like maintaining the rhythm of breathing and the heartbeat, which are essential for survival. In such instances, the brain may direct its limited resources toward these fundamental processes, leading to a reduced sensitivity to external stimuli. This shift can make you feel less aware of what's happening around you, as your body focuses on the most critical physiological needs. This reduction in sensory functions can, in turn, lead to a diminished ability to interact with your environment. Over time, this disconnection might cause you to feel increasingly isolated, as it becomes harder to engage with others or fully experience your surroundings. It can also lead to confusion, as your mind struggles to make sense of the world without the full range of sensory input it typically relies on. However, the encouraging news is that this symptom does not necessarily indicate a permanent decline or the inevitable end. In many instances, the decrease in sensory abilities can be linked to underlying conditions that are treatable or manageable. For example, vitamin deficiencies, such as a lack of B12 or other essential nutrients, can sometimes cause sensory impairments, but these can often be corrected with appropriate supplementation. Similarly, infections or other medical issues may be contributing to sensory changes, and these can often be treated with medication or other interventions. Because of this, it is crucial to remain proactive with your health. Regular medical checkups are essential for identifying any potential issues early on, and if you notice any changes in your sensory abilities, it's important to report them to your healthcare provider. With timely attention, many of these symptoms can be addressed, allowing you to regain a more connected and engaged experience with the world around you. Number 7. Alterations in consciousness. As the body and mind gradually prepare for the inevitable end, it is common to observe significant changes in consciousness. These alterations can manifest in various forms, including excessive sleepiness, periods of mental confusion, disorientation, and fluctuations between moments of lucidity and unconsciousness. Such shifts in awareness are often part of the natural process of dying and can be attributed to several factors, such as chemical imbalances in the brain, reduced oxygen supply to vital organs, or underlying infections affecting the body systems. One poignant example comes from a 78-year-old woman, Maria, who was confronting the final stages of advanced cancer. In her last days, Maria shared her deeply personal experience with those around her, recounting the profound effects on her consciousness. She described feeling a constant heaviness in her body, often slipping into a state of deep sleepiness that felt almost like an inescapable fog. During these moments, she would briefly awaken to find herself surrounded by her loved ones, but the connection felt fleeting. As soon as her awareness of her surroundings took hold, it was quickly replaced by an almost meditative tranquility that drew her back into a peaceful slumber. At times, Maria experienced episodes of confusion that left her disoriented. She would forget the details of recent conversations, at times struggling to recall the names of visitors who were close to her. The memory lapses were disconcerting, both for her and her family, but they were a natural part of the dying process. Despite these moments of mental fog, there were also occasions of unexpected clarity. In these rare instances of lucidity, Maria would express profound feelings of peace and deep gratitude, even as she fully understood that the end of her life was approaching. These fleeting moments of awareness were marked by a sense of calm acceptance, where she was able to acknowledge her journey and share heartfelt words with her family, offering them comfort during a time of inevitable loss. Number 8. Changes in breathing. As life draws closer to its end, changes in breathing become one of the most apparent and unmistakable indicators of this inevitable and natural process. It is not uncommon to witness a cyclical breathing pattern that alternates between periods of rapid, shallow breaths followed by extended, almost silent pauses. This pattern, known as Cheyne-Stokes breathing, reflects the body's gradual shift toward the final stages of life. The rapid breaths are often followed by longer pauses, during which the individual may seem to stop breathing entirely, only for the cycle to repeat. As the body begins to conserve energy for the most essential functions, breathing can also become more shallow and slower, with longer intervals between each breath. There may be times when the individual struggles for air, exhibiting more effortful or labored breathing, a phenomenon known as agonal breathing. These moments are often marked by pronounced gasps or irregular, deep breaths, signaling the body's growing difficulty in sustaining itself through the demands of normal life. The reason for these changes is rooted in the body's increasing exhaustion. After enduring years of physiological challenges and stress, the body starts to slowly dial down its functions. It conserves its energy, focusing only on those final vital processes required for survival, while the more routine, sustaining functions gradually slow down. The breathing alterations are simply one aspect of this gradual retreat into rest and preparation for the end. During this phase, it is not uncommon for unusual sounds to accompany the changes in breathing. Soft moans, gentle wheezing, or other faint noises may be heard, as the body's mechanisms for producing sound alter with the effort to draw breath. These sounds can be unsettling for those present, but they are a part of the process, reflecting the body's diminishing ability to communicate through normal means. For loved ones who are present and witnessing this profound transition, recognizing these signs can offer a deeper understanding of what is occurring. While these changes in breathing may initially seem alarming or unfamiliar, they are simply part of the natural rhythm of life, marking the body's quiet but determined preparation for its final stage. In these moments, there is an opportunity to accept and even find peace in the knowledge that the individual is following the course of life's inevitable and respectful end, honoring the natural process of transition. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 9. A sense of detachment. For those who are undergoing this process, there may be a subtle yet profound shift in perception. A gradual feeling of disconnection from one's own body can emerge, often accompanied by a diminished awareness of the physical surroundings. It may feel as though the body is becoming lighter, as if floating or gently drifting away. Physiologically, this shift is closely tied to the slowing down of brain functions, which happens as blood flow and oxygen levels decrease. As the body systems start to slow, the perception of reality and the state of consciousness itself begins to wane. This altered perception can manifest as a profound sense of detachment, where the individual feels more separated from the physical realm and from the everyday concerns that once seemed so pressing. Psychologically, This detachment may offer a release of the tensions that have accumulated over time. The mind may come to a peaceful acceptance of the inevitable, allowing for a deep sense of calm and tranquility to emerge. As the individual becomes less concerned with worldly matters, a feeling of inner peace may settle in, fostering a gentle distancing from the stresses and worries of life. This peaceful surrender can be both a natural and profound part of the transition process. Additionally, chemical changes within the brain, such as the release of endorphins and other calming neurotransmitters, can intensify this sense of serenity, contributing to the feeling of detachment and helping the individual find solace in the moment. For family and friends, understanding and recognizing these signs of detachment can be crucial in creating an atmosphere of support, comfort, and tranquility. Acknowledging that the loved one is experiencing a natural process, a transition toward the inevitable can help loved ones provide the compassionate care and understanding needed. This moment, though delicate and sometimes difficult, is an essential part of the cycle of life. Offering a space of calm and acceptance allows for a more peaceful and conscious transition, providing an opportunity for both the individual and their loved ones to embrace the final stages of the journey with grace and dignity. Number 10. Difficulty communicating. As individuals near the end of their lives, one of the most noticeable and often heart-wrenching changes they may experience is a gradual decline in their ability to communicate. This symptom, which is frequently subtle at first, can become progressively more apparent as the body begins to shut down. Communication, something many of us take for granted, is a multifaceted process that relies on both physical and mental faculties working in harmony. When these processes begin to deteriorate, individuals may find it increasingly difficult to express themselves clearly or meaningfully. At the heart of these communication challenges lies physical weakness. As the body weakens, so too do the muscles responsible for speech, such as the vocal cords, tongue, and lips. These muscles play an integral role in producing the sounds and words we use to communicate. As their function diminishes, speech may become softer, slurred, or distorted. In some instances, the ability to speak at all may be lost entirely, leaving individuals with limited means to express their thoughts and emotions. The frustration of being unable to communicate verbally can create a profound sense of isolation and helplessness for both the individual and their loved ones. In addition to physical limitations, cognitive decline can also contribute to communication difficulties during the end-of-life phase. Conditions such as dementia, Alzheimer's disease, or other cognitive disorders are commonly seen in older adults and can significantly impair one's ability to understand, process, and respond to language. These conditions can confuse, making it difficult for the individual to follow a conversation or retrieve the appropriate words to form coherent sentences. As a result, their speech may become fragmented, with words out of place or irrelevant to the context of the conversation. The cognitive impairment can also affect memory, making it harder for the person to recall recent events or even recognize familiar people. This confusion is not only distressing for the individual but also for their loved ones, who may struggle with feelings of frustration, sadness, and helplessness as they attempt to maintain meaningful conversations. The emotional and psychological toll of approaching the end of life can further complicate communication. Many individuals may become more reserved or withdrawn, often out of fear, sadness, or a desire to conserve their dwindling energy. The prospect of becoming a burden to loved ones or the overwhelming difficulty of accepting the reality of their mortality may lead to a reluctance to engage in conversations, even with close family members or caregivers. As a result, some individuals may have trouble expressing their needs, desires, or concerns, leading to feelings of frustration and emotional isolation. The inability to communicate effectively can create a barrier between the individual and those who want to provide support, further intensifying the sense of loneliness that often accompanies the final stages of life. In these challenging situations, it is of utmost importance for caregivers and loved ones to approach the individual with patience, empathy, and understanding. While verbal communication may no longer be possible in the same way, there are still numerous ways to connect on an emotional and spiritual level. Nonverbal cues, such as body language, facial expressions, and subtle gestures, can offer valuable insight into the person's emotional state and needs. A gentle touch, a comforting smile, or a reassuring glance can communicate volumes and help the individual feel seen and heard, even if they cannot respond in words. Furthermore, maintaining eye contact and speaking in a calm, soothing tone can help the person feel more secure and at ease, even when verbal exchanges become increasingly difficult. Caregivers should also be vigilant in advocating for the individual's well-being and comfort, even when communication becomes strained or impossible. This may involve paying close attention to their physical and emotional needs, assisting with daily activities, and ensuring that they receive the highest level of care possible. In some cases, medical interventions may be required to address underlying conditions that may be exacerbating speech and cognitive difficulties, such as infections, dehydration, or medication side effects. Caregivers may need to work closely with healthcare professionals to ensure that the person receives appropriate treatment and support, tailored to their unique needs. Ultimately, the challenge of communication difficulties at the end of life is a profound and often heartbreaking reminder of the inevitable progression toward the end. While it can be an emotionally difficult reality for both the individual and their loved ones, this signal mustn't be overlooked or ignored. By recognizing the decline in communication and responding with compassion, care, and patience, caregivers can help ensure that the person feels supported, valued, and loved during their final days. Even without the ability to communicate verbally, the emotional connection between the individual and their loved ones can remain strong, providing comfort and solace in a time of great vulnerability. If you are still watching this video and finding these lessons useful, please comment number 4 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 11. Unexplained weight loss. Unexplained weight loss is often regarded as one of the most concerning and sometimes even alarming signals that the body may be approaching the end of life. While it is not uncommon for older individuals to experience a decrease in appetite or slight weight loss, sudden, rapid, or unexplained weight loss is much more troubling and can point to something far more serious occurring within the body. This unexpected loss of weight could be an early warning that the body is beginning to deplete its vital energy reserves, which may indicate that essential organs are beginning to fail. The body typically relies on its natural energy stores to function day to day, and once it begins to run out of these resources, it starts utilizing fat and muscle mass to maintain crucial bodily functions. In many people, this process of gradual decline is a normal part of aging, and may not always signal immediate danger. However, when weight loss is rapid or occurs without any clear cause, it could be an indication that the body is struggling to survive, and vital organs such as the liver, kidneys, or intestines, which are responsible for digestion and nutrient absorption, may no longer be working as efficiently as they should. One of the most concerning aspects of unexplained weight loss is that, in the early stages, it can often go unnoticed. Many individuals may initially mistake the gradual decrease in appetite or energy levels as a typical part of the aging process. Over time, however, as the weight loss becomes more noticeable, it may become a clear indication that the body's ability to sustain itself is significantly weakening. For instance, a person who previously maintained a healthy weight might begin to lose pounds rapidly, despite not changing their eating habits or physical activity levels. This loss of weight can have a cascading effect on their overall health, weakening the immune system and making them more susceptible to infections and other serious health complications. Moreover, unexplained weight loss can have a profound and wide-reaching impact on an individual's quality of life. As the body loses muscle mass and fat stores, it becomes increasingly difficult to maintain strength and energy. This loss of strength can lead to feelings of fatigue, weakness, and an overall inability to perform daily tasks. In some cases, the loss of muscle mass can lead to joint pain, stiffness, and even mobility issues, which make it harder for the individual to move or carry out even basic activities. It is important to recognize that while unexplained weight loss is a cause for concern, it doesn't always signal that someone is nearing the end of life. Numerous medical conditions can contribute to rapid and unexplained weight loss, such as certain types of cancer, thyroid disorders, diabetes, or gastrointestinal issues. Therefore, it is essential for anyone experiencing this symptom to seek medical attention. A healthcare provider can perform a range of diagnostic tests to pinpoint the underlying cause of the weight loss and develop an appropriate treatment plan. In some cases, unexplained weight loss can be managed, and even reversed, with proper medical intervention. Nutritional support, including the introduction of calorie and protein-dense foods or supplements, can help restore lost weight and improve overall health. Additionally, treating any underlying medical conditions contributing to weight loss, such as infections, metabolic disorders, or chronic diseases, can help stabilize the individual's condition and significantly improve their quality of life. With the right care, it is possible to mitigate some of the impacts of unexplained weight loss and prevent further deterioration of the person's health. Number 12. Appearance of spots or rashes on the skin. The appearance of spots or rashes on the skin can serve as a concerning signal that the body may be struggling with underlying issues, particularly as it approaches the end stages of life. As the body ages, its natural processes, such as detoxification and circulation, often become less efficient. This decline can manifest externally in the form of skin changes, such as dark spots, discoloration, or rashes, which may be observed in various areas of the body. One common phenomenon is the development of dark spots, often referred to as age spots or liver spots. These spots typically result from prolonged sun exposure over the years or the body's diminished ability to break down and eliminate excess melanin, the pigment responsible for skin color. While age spots themselves are generally harmless, their sudden appearance, unusual size, or rapid increase in number could be a warning sign of declining circulation or difficulties in detoxification processes within the body. In more severe instances, rashes, red patches, or other irregularities on the skin may emerge as indicators of deeper health problems. These issues can arise from the body's inability to expel toxins effectively, leading to their accumulation in the skin and other tissues. As circulation slows, especially in the later stages of life, blood flow to the skin decreases. This reduction in circulation can result in waste products becoming trapped in the tissues, giving rise to visible skin changes such as spots, rashes, or even ulcers. These symptoms may point to underlying medical conditions, including infections or dysfunction in vital organs such as the liver, kidneys, or heart. Furthermore, skin changes can also reflect the body's declining capacity to maintain its natural balance. For instance, rashes or red patches may indicate systemic issues like organ failure or chronic inflammation. At times, these changes may result from skin irritation, allergic reactions, or increased sensitivity, which are more common as the skin becomes thinner and more fragile with age. While such reactions are not necessarily life-threatening, they should not be ignored, particularly if accompanied by other symptoms such as swelling, fever, pain, or fatigue. In addition to age-related processes, the appearance of these skin conditions could signify the progression of chronic illnesses or complications due to slowed detoxification and reduced immunity. For example, rashes could stem from infections that the body is no longer robust enough to fight effectively. When toxins accumulate in the bloodstream and tissues, they often leave visible traces on the skin, which serves as an external reflection of internal health. It's important to note that not all skin changes should immediately cause alarm. Some alterations, like minor dryness, small rashes, or isolated age spots, may simply be part of the natural aging process and do not necessarily indicate serious medical concerns. However, skin changes accompanied by other systemic symptoms warrant prompt medical evaluation. These additional symptoms might include persistent discomfort, unexpected fatigue, or worsening pain, which could point to conditions requiring urgent attention. Medical professionals can provide a thorough diagnosis to determine whether these skin changes are linked to manageable conditions like mild allergies or more severe issues such as organ dysfunction, circulatory complications, or infections. Early detection and treatment are critical to managing these symptoms effectively, improving quality of life, and preventing further complications. Recognizing and addressing these signs early on can make a significant difference in overall health outcomes, ensuring that any underlying problems are promptly and appropriately addressed. Now that we've explored the 12 warning signs that indicate the end of life and what to do in those moments, what have you learned so far? Take a moment to reflect, and let us know in the comments below. What's one thing you've learned from this video that you'll bring to practice in your life? If you found this video insightful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel. Your support helps us bring more valuable content to you. Thank you for watching, and we'll see you in the next video.